afternoon, everybody. It's a great pleasure to introduce Dr. Despina Demoupolos. She's one of our pediatric intensive care specialists at Donald Gordon in Johannesburg, but also a mother of two school-going boys. So she's going to take us through going back to school in the second wave. Thank you, Despina. And then maybe just in the meantime, if we can ask Prof. Preisner if he won't mind to answer some of the questions in the chat box. Despina, will you take us through school, going back to school? Despina, we just need you to unmute. We can't hear you yet.
Thank you. Thanks, Barra. Sorry for that. And thank you to all of you for joining our SAPA webinar. As an EXCO, we felt that doing the back to school part 2 is quite important and necessary with everything that's going on. So what I'll be doing in the next couple of minutes will be just a basic introduction. Why are we doing this talk? I won't go too much into the numbers as we've already had those discussions. What does the evidence say? And I think that's probably the most important part. What do the children say and what does SAPA recommend? So there's a lot of controversy regarding the reopening of schools in South Africa during this second wave. And as you've seen in the news in the last 2 to 3 weeks, there's very many conflicting views between the government, the teacher trade unions, political parties who will go to the schools and make sure that some schools don't open, civil society organizations, school governing bodies, and parents. And this has led to quite a bit of anxiety amongst parental, caregiver, and children. So a very fantastic article, well, not article, supplementary bulletin that's just come out from the NICD on the 22nd of January, the COVID-19 Special Public Health Surveillance Bulletin, actually really looks at children under the age of 19 up to the 2nd of January. And it actually analyzes what's been going on in terms of our country, in terms of our children, the different age groups, their comorbidities, their admissions, the deaths. So it's something I would definitely recommend having a look at. And what this shows us is that 9.2% of laboratory confirmed COVID-19 cases are children less than the age of 19. And 3.9% of all admissions in South Africa are with children less than 19, and those children comprise 37% of the population. So just a quick slide, we know this and it's been discussed that there has been an increase in this age group, but generally our children are not looking too bad. So we're going to look at the evidence in terms of different blocks. So firstly, I'm going to discuss children acquiring SARS-CoV-2 infection. So how do children acquire it? What's the incidence? And then we'll go on to their transmission and their risk of severe disease. So children are less likely to acquire SARS-CoV-2 than adults, and it's been the same in this second wave compared to the very first wave. So there are some references, and I can share this presentation, and also there's lots and lots of references that are coming out that I can share with you, showing us that children are less likely to acquire SARS-CoV-2, and children and adolescents younger than 20 years have a 44% lower odds of secondary infection, in other words, getting it from an index case when we do contact tracing, compared to adults more than 20 years. And this is predominant in the age group less than 10 to 14 years. Younger children are less likely to transmit the virus to each other and to staff, okay? And you can see there, lots of articles, some of them from last year, some of them during a lockdown, some of them when schools were back, and some stuff that's also come through this year, showing us that the children are less likely to transmit the virus. Adolescents are likely to have a slightly lower or a similar rate of transmission compared to adults. Pediatrics now in January published a very nice article on the incidence and secondary transmission of SARS-CoV-2 infections in children. And what the message that came across is that masking, physical distance, and hand hygiene are the way to go. And minimal clusters of infection and lower rates of secondary transmission in schools is what's taking place. So children going back to school don't seem to cause a larger community infection burden. And the data is showing that basically schools should be opening safely as long as everyone follows the prevention policies. So something that was published in National Geographic showed 53,000 schools, in Germany, and daycares that showed that in these schools, in the 32 schools, it was mainly adults transmitting the disease, even in the childcare setting. So as parents dropped their kids off or staff mingled in the break room, so that's how the infection spread. They did also note in Germany, so in a first world country, that when children weren't going to school, there was a definite increase in mental health concerns, domestic violence, and decreased learning. One very nice article that came out actually this week, well, the 22nd, 23rd, showing us the prevalence of SARS-CoV-2 infection in children and parents in Southwest Germany. This one actually specifically answers one of the questions that someone asked on the chat group. So this article actually breaks down the different age groups, 1 to 5, 6 to 10, and looks at the seroprevalence with the parents compared to the different age groups, and shows that obviously the children are really much lower, and there are lovely tables breaking it down. And one interesting point is they actually looked at children that attended exceptional child daycare. So in other words, when there was a lockdown, there were some families like essential health workers, frontline workers, that had to send the children to daycare. So, so there were quite a few that still got to go to daycare, and there was no change in terms of their seropositivity compared to those that weren't attending. So children, we think, transmit less, and that's what the evidence is showing us. There has been quite a huge study done with Public Health England, some recent research looking at contact tracing of about 20,000 people infected with the new variant, and almost 3,000 of those were children under the age of 10. And even though it's almost 50% more contagious than the previous variants, during their study, they found that young children will still half as likely as adults to transmit the variant to others. We don't know if this is exactly the same as what we're seeing here in South Africa, but we heard from Prof. Wolfgang that we do look at some of the UK, and there might be a similarity. Severity of disease. So children have much less severe disease, and almost 1% of severe cases and deaths. As Keith alluded to earlier, less than 1% of deaths are with children related to COVID. And there's no differences in the proportion of children that are admitted to public hospitals, admitted to ICU, or dying in hospital during the first wave versus the second wave in South Africa. And that's what's been looked at in this supplementary issue from the NICD, which is great news for us. So a lot of the hype has been about the teachers, and as much as we obviously worry and care a lot about our teachers, it has been shown that the teachers have the same risk of acquiring COVID as any other profession or individual in the community. So they are at a higher risk of contracting the virus from other adults, as I mentioned, so their colleagues at home or in the community. So during their coffee breaks, just like ourselves and our nurses in the hospital, this is where the transmission is going to happen, and not actually from the children that they are teaching. So when you look at the evidence regarding school opening and what's been going on around the world, we can definitely show that there's no consistent changes in incidence trends associated with timing of opening or closing. And that's been shown in the South African data now in the NICD, but also actually throughout the world. So schools are not an important site of transmission. And they actually just show us what's going on in the community, but whether or not you have the school open or closed, there are no consistent changes in the incidence. Outbreaks were uncommon in educational settings, and this was published in December in England, and then there was also a publication from Mississippi looking at a lot of that was outpatients, but they've looked at educational settings, and children don't seem to be contributing, so making the pandemic worse in terms of outbreaks. So there's a strong association with the incidents, just basically looking at what's going on in the community. So if you control your community transmission, then you will protect the children and the teachers. So attending school or childcare is not associated with receiving positive SARS-CoV-2 results amongst children and adolescents aged less than 18. And that's one of the studies, the second one here from Mississippi, where they looked at close contacts with persons with COVID-19. And where the infection came from was the gatherings and those that didn't, so the places in the states where they didn't use masks in the school, and basically from the household. So if you are in a school that follows the precautions, there's no increase in terms of outbreaks in those settings. So our priority is to keep the virus out of the schools. So our priority to keep the virus out of the schools is to keep it out of the community. So in terms of reduction of transmission, as I mentioned earlier, the mitigation policies like masking, physical distance, and hand hygiene have been shown to cause minimal clusters of infection. And so if we follow these, we won't be causing a larger community burden. And this was published by Zimmerman in Pediatrics. So our advisory committee are also, this is what they're advising. So if you want to reduce transmission, you've got to control what you do to the environment. So in other words, ensure ventilation and sufficient space. So administrative controls. So in other words, staggering the timetables, the screening, cough etiquette, and appropriate environmental cleaning. And then the personal equipment. So we need to make sure that everybody's wearing the masks and the visors. So one thing that's been very important and really at the heart of SAPA has been how our children have been indirectly affected during this pandemic. And being a pediatrician, I'm sure you all know, and I'm sure you've all seen in your practices and in your hospitals, how this pandemic has negatively affected our children, not by direct infection, but more by indirect or collateral damage, as we call it. So we have seen that there's been impact on communities, on families and children. So the community has definitely been increased in poverty, definitely worse social circumstances, families, so families have died and children have indirectly suffered from those consequences. And then with regards to our children, there's definitely been a poorer mental health, increasing behavioral and developmental concerns, lack of access to play and social opportunities, increased isolation, academic impacts, child abuse and neglect. And we saw that was very interested to see what Keith Kluter showed us earlier on, that 25.3% increase in trauma and violence against children just related to alcohol. If you go onto the UNICEF website, you can actually see the impacts of COVID-19 on nutrition. And this is what's being predicted, is that an additional 6.7 million children under 5 could suffer from wasting in the next 12 months. Children have missed their vitamin A doses. There's been huge hunger. Children are missing their one meal for the day. Other things like women and girls that are dropping out of school, and women's access to nutritional services. So our mother and child health has also been affected. So we know that the COVID-19 and the pandemic have really affected our children. So what SAPA looks at is the risk versus the benefit. And what we are saying, the major benefits of reopening for our children, as you can see there, allowing our children to complete their studies and continue to the next level, giving them access to the essential services, to nutrition, child welfare, preventing violence against children, social and psychological well-being, access to reliable information, benefiting the society, physical, mental health, and therapeutic services, and forming relationship with peers to peers and adults, opportunities for play, so important in our early child development, and other developmental necessities. So we know that with the children going back, they will have access to the school nutrition program. So the children who've definitely suffered are the poorer children. So they'll be able to have access to the school nutrition program and positive impact on their learning. The DBE is saying that about 20% of school children are benefiting from online schooling. As we know, many children do not have resources. And so 20% of our population, of our children, is actually being educated when we are keeping our children away. Also, by sending our children back, it allows the parents and the caregivers ability to return to work, which is very important when you're struggling as a family. And as I'm saying over and over again, it's more than just the education. There's the nutrition, the food security, physical and psychological safety. But let's look at what the children say. So the Commissioner for Children actually recently wrote an article after interviewing the children, and the children are saying that they do want to go back, but they want to be protected. The schools need to follow the health protocols, and the educators must model good behavior. So in other words, when the teachers are teaching, they need to have their masks on or their visors. They shouldn't be taking them off because they feel uncomfortable. We need to set a good example for our children. And as I often say to many people that ask for advice, especially when they start saying to me that children don't like masks and it's uncomfortable, and I say, if you set a good example, your children will follow. Seeing that with my own children, as long as I've made it the rule and this is how we go, they are actually very comfortable with wearing the mask. So SAPA has previously published a statement in May last year regarding going back to school, and we're about to publish our second statement with regards to the second wave, and that should be coming out tomorrow or the next day, and this is what we are recommending basically. So children should be returning to school immediately. Children with severe immunosuppression, uncorrected significant congenital heart conditions, chronic organ failure, chronic severe respiratory disease, and severe neurodevelopmental disability may be safe at home, but should be looked at by a specialist and get pediatric specialist advice. Schools should undertake measures that are known to reduce pathogen transmission, and I've gone through that in detail. Children older than 5 years should be required to wear a cloth face mask to prevent disease transmission. And I'll refer you to the WHO website. It actually has a whole document related to cloth mask wearing for children. Sick learners, teachers, and other staff should not go to school. Children should receive intensive age-appropriate education around the behavior change required for them for the first few days back at school and regularly thereafter. So we've recommended to schools during their first period to take a few minutes to just remind the children about the protocols and just to reiterate every day, especially for the first few days. Additional measures like staggering the school starting, changing the starting and ending times, different break schedules should be considered. Extracurricular activities at school, including contact sports, should be strictly controlled to reduce transmission risk. So there have been cases where indoor sports practice or competition have increased the risk of transmission. So we would not recommend currently where we are in this pandemic that schools should be restarting these contact sports or these indoor sports practices. Just to reiterate, children who are sick must stay at home, but also children whose parents are sick should still stay at home even if they are well. So as I've just said, children who are well but have an infected household contact should remain at home for 10 days from the onset of the contact symptoms. If a child develops symptoms, ideally should be tested, and if negative, he or she can return to school immediately. If positive or if no testing is done, the child will have to remain at home for 10 days. So if a child has a high-risk individual at home, like an elderly grandparent, they should be advised to reduce contact time with them or do this more safely, in other words, wearing a mask, sanitizing, and social distancing. So if a parent is sick with COVID, the child should stay away from school for 10 days, but does not actually need a negative test to come back to school after that. So there is DBE guidance on what constitutes a school outbreak and when a school should be considered for full or partial closure because of an increase in cases. Sorry, that's my comment. There's apparently DBE guidance on this, so please excuse that. And regular reassessment and evaluation of the procedure is going to be very crucial over the next few months. So we know that there's going to be, and we heard it earlier on, there's going to be a third wave most likely coming in June, July, and another one in September. So we know that we're going to go up and down with these waves. And so we do have to safely live through this. So what can we as pediatricians or healthcare workers do? We can make sure that our children's vaccinations are up to date and encourage our families to make sure the vaccinations are up to date. We need to educate our parents to know the symptoms for themselves and for their families. We need to openly talk about COVID-19, and there are multiple resources available, especially for anxious children or anxious parents, to try and help them understand COVID-19 and how to even speak to their children about COVID-19, and even about going back to school. Behavior is very important. So we know that there are super spreader events, and we saw that recently with the rage and with the tin party. So we know that people in their 20s and 30s have sparked outbreaks. And in some school surveys, they showed that a third of families are still actually socializing quite openly. So we need to keep encouraging our families and reassuring them that the way that we're going to keep COVID out of the schools is if we actually keep it out of the community. So we need to social distance and we need to not attend any super spreader events. So as I said, infection will go up and down in the next year. And children and adolescents are definitely less susceptible than any other age group, and they're also less likely to be hospitalized following infection. The benefits of sending our children back to school really outweighs the risks, and I've showed you the evidence. And we as a group, as colleagues and as parents need to commit to the health and well-being of our children in South Africa. So please keep calm. School is going back soon. Some people are going back next week, some kids. The plan is hopefully that everybody's back by the 15th of February. But we will be sending out our statement soon. And I just want to say thank you to SAPA, to the EXCO, to the PMG, to the NICD, and to all the evidence that's out there, and to actually every single one of the pediatricians that are here today who are actually helping our kids get back to school. Thank you.
Thank you very much, Despina, for a lovely presentation. I just want to ask Haroon Saluji if he wants to add anything, because we were just on a simultaneous Ministerial Advisory Committee meeting about schools going back. Haroon, did you want to add anything?
Thanks for the opportunity. No, I don't think I want to add anything. I think the Education Department are going to be releasing a statement, and I think the plan is that public schools will open on the 15th of February, both primary and secondary schools. And the expectation is that the independent schools will open on the 1st of February. So there will be this differential opening. But the good news is that the plan is that schools are going to be opened. That's all I'll say for now.
Thank you very much. Guys, so I think we've come to the end of our time. I'm just aware of the fact that we're probably going to run out of our time because it's an hour and a half into the session. I just want to say thank you very much to all the speakers, and thank you to everybody who has commented, and we'll try and answer some of those questions. We will be, we have recorded this session, and so we will be distributing that as well. And we hope to have another COVID webinar, probably the last week of February again. As there seems to be quite a lot to talk about, and by then the kids will have been back at school for 2 weeks. So I just want to say thank you very much to everybody. Stay safe, keep your social distancing, and clean your hands. Thank you very much, everybody.